Thank you, and good afternoon. Before I start, on behalf of my colleagues from the American Academy of Pediatrics in the audience and myself, I want to thank Dr. Arora and his outstanding ECHO team for this partnership that we are embarking on between the American Academy of Pediatrics and Project ECHO, and for this kind invitation to share some of our progress so far. So thank you, Dr. Arora. As we get started, I just want to take a moment for all of us to think of a child that's very special to us. It could be our own son or daughter, a grandchild, a niece, or a nephew. So just take a second and just see his or her picture in front of you. And as you see that picture, just think, what would you do if that child needed medical care? As a father of two young children, I know what I would do. I would do anything. I would do anything to make sure that my children got the best possible care. And yet, I also know that when I work in the pediatric intensive care unit, where we see a lot of children with complicated issues and seizures, which we'll be talking about momentarily, despite our attempts as parents to do everything, that everything is not enough. Our health systems do not allow that everything to come to reality to the child. As a father of two children, I find that unacceptable. And as a physician, as a pediatrician, I think that's wrong. And we must do something about it. That has to change. Just a few days ago, I was working in the intensive care unit, which provides care for children with epilepsy. And on the face of, as I was thinking about this last few days, I was remembering this child I took care of and the child's parents, and on their face was fear. And it's that same picture of fear which I've seen so many times on the face of our parents, who are scared what will happen to that child. So imagine a child, a young child, a 5, 10, 15-year-old child, adolescent, who was doing well until a few days ago and suddenly has seizures, which is not uncommon. You rush the child to the emergency department, gets immediate care, then goes to see their pediatrician, and the pediatrician is a well-meaning person, a really good person, but is uncomfortable in being able to provide that level of subspecialty, specialty expertise, which a neurologist would provide. And you want to then see a pediatric neurologist. And despite all our efforts, despite the efforts of the pediatrician, the wait time to see the pediatric neurologist is 6 months. That's real. And the average wait time in the US is many months based upon where we are. 3, 4, 5, 6, 9 months. That's not uncommon whether one is in a remote rural area or a large metropolitan area. And as we go outside the US globally, there are areas within the world where there may not even be access to a pediatric neurologist. So, as a parent, we are living in the fear of not knowing whether our child is getting the optimal care. Despite our efforts to do everything, that everything fails. We fall short of what we want to do for our child. This must change. So what have we done about it? So this is the exciting part. Last year, the American Academy of Pediatrics was privileged to receive federal funding from the Maternal and Child Health Bureau to serve as the coordinating center in the US to improving access to children and youth with epilepsy. This is a very interesting story because within our grant proposal, one of our components was to do a pilot with Project ECHO in the state of New Mexico. And when we submitted the grant, we thought we'll get some learnings, get through the 3-year grant duration, and then maybe expand it after that. So earlier this year, Trisha, our program coordinator in the audience, and myself, we visited Project ECHO, met Dr. Arora, Jeannie, and others from the ECHO team. And it was fascinating to see the vision of Project ECHO. And as we went back to Chicago, to the academy, we reached out to the Maternal and Child Health Bureau with what we had seen. And as the first ECHO clinic was implemented in New Mexico, which was about 3 months ago, what's been exciting is that what was planned to be for us to wait for 3 years got accelerated. In the last 3 months, the ECHO clinics in Albuquerque in pediatrics have been launched. In 3 months, there have been over 300 healthcare encounters, several patients, and a vibrant weekly clinic that's underway. This led to a midstream change in our grant strategy, which was approved by the Maternal and Child Health Bureau, and the new direction includes expanding the model rapidly to 4 additional states: Colorado, Kansas, Missouri, Illinois, and very soon, New York. So this is unprecedented and very exciting. Our aim is to leverage the Project ECHO methodology to improve access to children with epilepsy and provide them instant access to subspecialty pediatric epilepsy and neurology services. And I believe this is only going to grow. This is just the start. So where can we go even further? So the American Academy of Pediatrics, many of you may be aware, is a member organization, which means our membership comprises of primary care pediatricians, pediatric subspecialists, and surgical subspecialists and specialists. There's over 62,000 members of the Academy across the globe. It's an international organization based out of the Chicago area. The Academy has a very long-standing, successful track record in accomplishing global outcomes for children. Many of you may be aware, but the medical home concept was coined by the American Academy of Pediatrics. Efforts like Back to Sleep have saved thousands of lives of children around the globe. A more recent effort, Helping Babies Breathe, has resulted in reduction of infant mortality by more than 40% in Tanzania. These are measurable, successful outcomes. So the Academy has a strong track record in a global perspective. We want to reach out to every child, no matter where that child is. It's our obligation to do that. So we want to partner the vision of the American Academy of Pediatrics' global reach with that of ECHO. It was fascinating yesterday and today to hear Dr. Arora talk about the vision to reach out 1 billion individuals. I would submit that we cannot reach out to 1 billion individuals unless we reach out to children, no matter where the children are: Asia, India, Africa, the US, South America. We have to include children in the mix. Lastly, many of you may feel that, well, we are not involved in pediatrics. We are more of adult healthcare folks. Why should we care for pediatrics? The reality is that the research has shown that early investment in children is the mechanism for improvements in outcomes in adulthood, be it in diabetes, be it in chronic conditions, acute conditions. If we want to impact adult population health, we must start in children. I know we'll all be heading back to our day jobs very soon, and when we go back, I'm sure we'll hear questions from our colleagues who are more skeptics as to why should we do this? That's not our problem. So I'll end by a famous quote which really resonated with me by John Lewis and has been used many times over the years. If not us, then who? And if not now, then when? The time is now to realize the vision of 1 billion people. Thank you.